Question 1. A patient with a recent history of abdominal surgery presents with fever, tachycardia, and hypotension. The nurse suspects sepsis. Which of the following additional assessments would be most indicative of septic shock? A. Decreased peripheral pulses and cool extremities. B. Severe generalized muscle weakness. C. Increased bowel sounds and abdominal distension. D. Sudden onset of confusion and altered mental status. Answer. A. Decreased peripheral pulses and cool extremities. Rationale. Decreased peripheral pulses and cool extremities are signs of poor perfusion, which is characteristic of septic shock. While confusion and altered mental status are common, they are more related to the progression of sepsis rather than the hallmark signs of septic shock. Muscle weakness and gastrointestinal symptoms are less specific to septic shock. Question 2. A patient with sepsis has been receiving broad-spectrum antibiotics for 24 hours, but their lactate levels remain elevated at 4.5 mol per liter. What is the next most appropriate intervention? A. Administer a second dose of antibiotics. B. Start vasopressor therapy to support blood pressure. C. Increase the dose of antibiotics. D. Obtain a CT scan to identify a potential source of infection. Answer. B. Start vasopressor therapy to support blood pressure. Rationale. Persistent elevated lactate levels suggest that the patient's tissue perfusion is inadequate despite initial antibiotic therapy and fluid resuscitation. Vasopressors are necessary to maintain blood pressure and improve perfusion. Antibiotic adjustments and imaging should follow once perfusion is stabilized. Question 3. A patient with sepsis secondary to pneumonia is on a mechanical ventilator. Which of the following interventions would best support the patient's respiratory status? A. Increasing tidal volume on the ventilator. B. Administering high-dose corticosteroids. C. Adjusting ventilator settings to prevent volatrauma. D. Suctioning the airway every hour to clear secretions. Answer. C. Adjusting ventilator settings to prevent volatrauma. Rationale. In mechanically ventilated patients with sepsis, it's crucial to optimize ventilator settings to minimize volatrauma, which can worsen lung injury. Suctioning should only be done as needed, and corticosteroids are typically not used unless there is an underlying inflammatory response. Increasing tidal volume can cause further harm in patients with compromised lungs. Question 4. A patient with sepsis is being managed with fluid resuscitation and vasopressors, but remains hypotensive. Which of the following diagnostic tests is most critical in determining the cause of persistent hypotension? A. Arterial blood gas (ABG). B. Chest X-ray. C. Central venous pressure (CVP) monitoring. D. Urinalysis. Answer. C. Central venous pressure (CVP) monitoring. Rationale. Persistent hypotension despite fluid resuscitation suggests inadequate preload or volume status, and CVP monitoring can help assess if the issue is related to low circulating blood volume or inadequate cardiac output. An ABG, chest X-ray, or urinalysis may provide useful information, but are not as directly linked to assessing volume status in this scenario. Question 5. A 75-year-old diabetic patient with sepsis is receiving intravenous fluids and antibiotics. His blood glucose is 180 milligrams per deciliter. Which of the following actions should the nurse take next? A. Administer a sliding scale insulin dose. B. Increase the rate of intravenous fluids. C. Administer a dose of hydrocortisone. D. Continue monitoring glucose every 4 hours. Answer. A. Administer a sliding scale insulin dose. Rationale. Sepsis often causes hyperglycemia due to the body's stress response, and insulin administration may be necessary to maintain blood glucose levels within a safe range. While increasing fluid intake may be required, insulin therapy should be prioritized to avoid complications from hyperglycemia. Hydrocortisone is not indicated in this case unless there is adrenal insufficiency. Question 6. A patient with sepsis and acute kidney injury, AKI, is showing signs of fluid overload, including edema and dyspnea. What is the most appropriate nursing intervention? A. Increase intravenous fluid administration. B. Administer a loop diuretic as prescribed. C. Perform hourly assessment of urine output. D. Reduce the dose of antibiotics. Answer. B. Administer a loop diuretic as prescribed. Rationale. Fluid overload is a common complication of sepsis, especially with AKI. Administering a loop diuretic will help reduce excess fluid, alleviate symptoms of edema and dyspnea, and prevent worsening of kidney function. Increasing fluids would exacerbate the condition, and the dose of antibiotics does not address the fluid imbalance. Question 7. A patient with sepsis secondary to urinary tract infection, UTI, is on broad-spectrum antibiotics. Blood cultures show no growth after 48 hours. Which of the following should be considered next? A. Continue broad-spectrum antibiotics for another 24 hours. B. Switch to a more specific antibiotic based on clinical improvement. C. Discontinue antibiotics and monitor for worsening symptoms. D. Perform additional imaging to identify other sources of infection. Answer. D. Perform additional imaging to identify other sources of infection. Rationale. If blood cultures show no growth but clinical symptoms persist, further imaging studies, such as an abdominal CT scan, should be done to rule out other potential sources of infection. Continuing broad-spectrum antibiotics or switching to a more specific antibiotic without identifying the source may delay appropriate care. Question 8. A patient with sepsis is being weaned off a ventilator but develops increasing respiratory distress. What is the first intervention to address the underlying cause of this distress? A. Increase the oxygen flow rate on the ventilator. B. Administer a bronchodilator as prescribed. C. Perform chest physiotherapy to mobilize secretions. D. Reassess the patient's lung compliance and ventilator settings. Answer. D. Reassess the patient's lung compliance and ventilator settings. Rationale. Respiratory distress in a patient who is being weaned off mechanical ventilation can be related to compromised lung compliance or inappropriate ventilator settings. The nurse should first reassess the ventilator settings to ensure they are appropriate for the patient's current respiratory status. Other interventions like bronchodilators and chest physiotherapy may be necessary, but are secondary actions. Question 9. A patient with sepsis is showing signs of disseminated intravascular coagulation (DIC). Which of the following laboratory findings would most likely confirm this diagnosis? A. Low platelet count and elevated prothrombin time (PT). B. High white blood cell count and elevated C-reactive protein (CRP). C. Low hemoglobin and elevated lactate levels. D. Increased bilirubin and decreased creatinine. Answer. A. Low platelet count and elevated prothrombin time (PT). Rationale. DIC is characterized by widespread clotting and bleeding, often seen in sepsis, and results in a low platelet count and elevated PT. The other lab findings are not specific to DIC. WBC count and CRP elevation are indicators of infection, but they do not confirm DIC. Question 10. A patient with sepsis has persistently elevated lactate levels despite appropriate antibiotic therapy and fluid resuscitation. What does this most likely indicate? A. Ongoing infection and poor tissue perfusion. B. Elevated glucose levels due to stress response. C. Renal failure resulting in decreased lactate clearance. D. A metabolic disorder unrelated to sepsis. Answer. A. Ongoing infection and poor tissue perfusion. Rationale. Persistently elevated lactate levels indicate that tissue hypoxia and poor perfusion are ongoing despite treatment. This may suggest that the infection is not adequately controlled or that there is inadequate tissue perfusion, which are hallmarks of severe sepsis or septic shock. Question 11. A patient with sepsis is being managed with vasopressors and fluid resuscitation. What is the primary goal of using these interventions? A. To eliminate the infection. B. To restore blood pressure and organ perfusion. C. To reduce the fever associated with sepsis. D. To promote fluid and electrolyte balance. Answer. B. to restore blood pressure and organ perfusion. Rationale: the primary goal of vasopressors and fluid resuscitation in sepsis is to maintain adequate blood pressure and ensure perfusion to vital organs. While managing infection and fever are important, the immediate priority is stabilizing circulatory function. Question 12. A patient with sepsis secondary to an infected wound requires a surgical intervention. What is the most important factor to consider before proceeding with surgery? A. Ensuring the patient's body temperature is normalized. B. Confirming that the patient's nutritional status is optimal. C. Ensuring that adequate antibiotic therapy has been initiated. D. Assessing the patient's level of pain and anxiety. Answer: C. Ensuring that adequate antibiotic therapy has been initiated. Rationale: it is critical to begin appropriate antibiotic therapy before surgery to control the infection and reduce the risk of further sepsis. While normalizing temperature and optimizing nutrition are important, they are secondary to controlling the infection. Question 13. A patient with sepsis is receiving intravenous fluids and antibiotics, but their urine output is decreasing. What is the most appropriate next step in managing this patient's renal function? A. Start an intravenous diuretic to promote urine output. B. Monitor urine output and renal function tests closely. C. Increase fluid resuscitation significantly. D. Initiate hemodialysis immediately. Answer: B. Monitor urine output and renal function tests closely. Rationale: decreased urine output may indicate kidney dysfunction, but it should first be closely monitored alongside renal function tests before initiating diuretics or hemodialysis. Increasing fluid administration may worsen fluid overload if not carefully monitored. Question 14. A patient with sepsis develops refractory hypotension despite fluid resuscitation and vasopressor therapy. What is the next most appropriate step? A. Increase the dose of vasopressors. B. Administer blood products to correct anemia. C. Perform imaging to identify a new source of infection. D. Consider adding a second vasopressor to the regimen. Answer: D. Consider adding a second vasopressor to the regimen. Rationale: when hypotension is refractory to fluid and vasopressor therapy, adding a second vasopressor, such as vasopressin, can help improve vascular tone and blood pressure. Administering blood products is typically indicated for anemia, but not for hypotension and sepsis. Question 15. Which of the following clinical findings would be the most concerning for a nurse caring for a patient with sepsis? A. Pulse rate of 95 bpm. B. Respiratory rate of 28 breaths per minute. C. Blood pressure of 88/56 millimeters of mercury. D. Temperature of 100.4 degrees Fahrenheit. Answer: C. Blood pressure of 88/56 millimeters of mercury. Rationale: hypotension, especially with a blood pressure of 88/56 millimeters of mercury, is the most concerning finding in a patient with sepsis, as it indicates inadequate perfusion and potential septic shock. Elevated pulse and respiratory rate can be indicative of sepsis, but they are not as concerning as hypotension in this scenario. Question 16. What is the primary reason for administering corticosteroids in a patient with sepsis who is not responding to vasopressor therapy? A. To decrease inflammation and improve circulation. B. To suppress the immune system and reduce infection. C. To increase blood glucose levels for energy. D. To manage adrenal insufficiency associated with sepsis. Answer: D. To manage adrenal insufficiency associated with sepsis. Rationale: corticosteroids may be administered to patients with sepsis who have signs of adrenal insufficiency, as their ability to produce cortisol is impaired. This is not a routine intervention for all septic patients, but is used in specific cases where adrenal support is necessary. Question 17. A nurse is caring for a patient in septic shock who is not responding to initial interventions. Which of the following factors should the nurse consider as a potential cause of the patient's condition? A. Lack of infection source. B. Hypovolemia due to excessive fluid loss. C. Presence of underlying chronic illnesses. D. Inappropriate use of antibiotics. Answer: C. Presence of underlying chronic illnesses. Rationale: chronic illnesses, such as diabetes or heart disease, can complicate sepsis and make it more difficult to manage, potentially leading to a poor response to initial treatments. The infection source should always be identified, but the underlying health status plays a critical role in patient outcomes. Question 18. A patient who is critically ill with sepsis is at risk for developing multiple organ dysfunction syndrome MODS. Which of the following interventions has the greatest potential to prevent or limit MODS? A. Continuous monitoring of vital signs and organ function. B. Aggressive nutritional support to enhance recovery. C. Timely administration of appropriate antibiotics. D. Early mobilization and physical therapy. Answer: C. Timely administration of appropriate antibiotics. Rationale: early and appropriate antibiotic administration is critical in sepsis, as it is the most effective way to control the infection and prevent the progression to MODS. Monitoring and supportive care are important, but secondary to treating the underlying infection. Question 19. A patient in septic shock has persistent tachycardia despite adequate fluid resuscitation and vasopressors. What is the most likely cause of this tachycardia? A. Hyperthyroidism. B. Pain and anxiety. C. Decreased cardiac output due to septic myocarditis. D. Anemia related to blood loss. Answer: C. Decreased cardiac output due to septic myocarditis. Rationale: septic myocarditis can lead to impaired cardiac function, which in turn increases heart rate as the body attempts to compensate for decreased cardiac output. While pain and anxiety can increase heart rate, persistent tachycardia in septic shock is most often due to cardiac dysfunction. Question 20. What is the most appropriate next step in managing a patient with sepsis who is showing signs of worsening respiratory distress and hypoxia? A. Increase oxygen delivery via non-rebreather mask. B. Perform a chest X-ray to evaluate for a new source of infection. C. Increase ventilator settings to deliver more tidal volume. D. Administer bronchodilators to open the airways. Answer: A. Increase oxygen delivery via non-rebreather mask. Rationale: increasing oxygen delivery via a non-rebreather mask is the first step in addressing worsening hypoxia in sepsis. A chest X-ray and bronchodilators may be necessary afterward, but improving oxygenation is the immediate priority. Adjusting ventilator settings would only be appropriate if the patient is on mechanical ventilation. Question 21. A patient with sepsis develops acute renal failure and has a serum creatinine level of 3.2 milligrams per deciliter. What is the most appropriate nursing intervention? A. Administer a nephrotoxic medication to manage infection. B. Monitor kidney function closely and adjust fluid therapy as needed. C. Start hemodialysis immediately. D. Decrease fluid intake to prevent further renal injury. Answer: B. Monitor kidney function closely and adjust fluid therapy as needed. Rationale: close monitoring of renal function is essential in sepsis, especially with elevated creatinine. Fluid management should be adjusted to avoid fluid overload while supporting kidney function. Immediate dialysis is not indicated unless renal failure worsens or other criteria are met. Question 22. A patient with sepsis and a history of diabetes is receiving insulin therapy. The nurse notes a sudden increase in blood glucose to 250 milligrams per deciliter. Which of the following is the most likely cause? A. Stress response to infection. B. Overuse of insulin. C. Renal failure. D. Inadequate antibiotic therapy. Answer: A. Stress response to infection. Rationale: sepsis and infection trigger a stress response in the body, which increases the release of stress hormones like cortisol and catecholamines, leading to elevated blood glucose. While renal failure can affect insulin clearance, stress response is the most likely cause in this scenario. Question 23. A 50-year-old patient with sepsis has persistent hypoxia despite adequate ventilation and oxygen supplementation. What is the next most appropriate action? A. Increase tidal volume on the ventilator. B. Administer bronchodilators. C. Obtain a chest CT to evaluate for pneumonia or ARDS. D. Administer corticosteroids to reduce inflammation. Answer: C. Obtain a chest CT to evaluate for pneumonia or ARDS. Rationale: persistent hypoxia despite ventilation suggests a potential complication like pneumonia or ARDS. A chest CT is the most appropriate next step to identify underlying lung pathology. Tidal volume adjustment and bronchodilators may be used later depending on findings. Question 24. A patient with sepsis has a lactate level of 5.2 mol per liter after 12 hours of fluid resuscitation. What does this elevated lactate level most likely indicate? A. Improved tissue perfusion. B. Progression to septic shock. C. Inadequate antibiotic coverage. D. Ongoing tissue hypoxia despite treatment. Answer: D. Ongoing tissue hypoxia despite treatment. Rationale: an elevated lactate level after fluid resuscitation indicates that tissue hypoxia persists despite initial interventions. This suggests inadequate perfusion, which is a hallmark of septic shock or severe sepsis. Question 25. A patient with sepsis secondary to a urinary tract infection is showing signs of septic shock. Which of the following assessments should the nurse prioritize? A. Assessing neurological function. B. Monitoring blood pressure and heart rate. C. Checking oxygen saturation levels. D. Performing a head-to-toe assessment for injuries. Answer: B. Monitoring blood pressure and heart rate. Rationale: the most important parameters to assess in septic shock are blood pressure and heart rate, as they reflect the patient's circulatory status and response to sepsis. Oxygen saturation and neurological function are also important, but secondary to circulatory monitoring. Question 26. A 68-year-old patient with sepsis and COPD develops severe respiratory distress. Which of the following would be the most effective intervention to improve oxygenation? A. Increase the flow rate of oxygen via nasal cannula. B. Place the patient in a high Fowler's position. C. Increase tidal volume on the ventilator. D. Administer intravenous fluids to improve perfusion. Answer: B. Place the patient in a high Fowler's position. Rationale: positioning the patient in high Fowler's helps improve lung expansion and facilitates easier breathing, especially in patients with respiratory distress. Oxygen flow rate should be adjusted as needed, but positioning is crucial for improving oxygenation in COPD patients. Question 27. A patient with sepsis has a blood pressure of 90/60 millimeters of mercury despite receiving 2 liters of intravenous fluids. What is the next appropriate intervention? A. Administer a vasopressor to raise blood pressure. B. Increase the rate of intravenous fluids. C. Administer a corticosteroid to manage the inflammatory response. D. Perform a chest X-ray to assess for pulmonary complications. Answer: A. Administer a vasopressor to raise blood pressure. Rationale: when hypotension persists despite adequate fluid resuscitation, vasopressors are indicated to restore blood pressure and maintain organ perfusion. Increasing fluids further could worsen fluid overload, and corticosteroids or chest X-rays are not the priority at this stage. Question 28. A patient with sepsis is being treated with broad-spectrum antibiotics. The nurse notes that the patient's blood cultures remain negative after 48 hours. What should the nurse consider next? A. Continue the current antibiotic regimen for another 48 hours. B. Switch to a narrower spectrum antibiotic based on patient improvement. C. Stop antibiotics and monitor the patient for worsening infection. D. Consider other potential sources of infection and perform additional imaging. Answer: D. Consider other potential sources of infection and perform additional imaging. Rationale: persistent sepsis despite negative blood cultures warrants further investigation into other potential sources of infection, for example, abdominal, urinary. Imaging studies should be done to identify these sources, as the patient may still have an undiagnosed infection. Question 29. A patient with sepsis is receiving antibiotics but remains febrile. What is the most likely explanation for this persistent fever? A. The patient is developing a secondary infection. B. The antibiotics are ineffective against the infection. C. Fever is a normal part of the body's response to infection. D. The patient's immune system is suppressing the fever. Answer: C. Fever is a normal part of the body's response to infection. Rationale: fever is a common response to infection and is often seen in sepsis despite appropriate antibiotic therapy. It is not always indicative of antibiotic failure or a secondary infection. Close monitoring and supportive care are necessary. Question 30. A patient with sepsis develops signs of disseminated intravascular coagulation (DIC), including petechiae and bleeding from the gums. What is the priority nursing action? A. Administer fresh frozen plasma (FFP) to correct coagulopathy. B. Increase fluid resuscitation to restore circulatory volume. C. Monitor platelet count and coagulation studies. D. Initiate a blood transfusion. Answer: A. Administer fresh frozen plasma (FFP) to correct coagulopathy. Rationale: the priority in DIC is to address the coagulopathy with appropriate blood products, such as FFP, to restore clotting factors. Monitoring platelet count and coagulation studies is important, but secondary to intervention. Question 31. A patient with sepsis is on mechanical ventilation and has developed signs of acute respiratory distress syndrome (ARDS). What is the most appropriate next intervention? A. Increase tidal volume settings on the ventilator. B. Administer bronchodilators to reduce airway resistance. C. Adjust the ventilator settings to protect the lungs from further damage. D. Increase the fraction of inspired oxygen (FiO2). Answer: C. Adjust the ventilator settings to protect the lungs from further damage. Rationale: in ARDS, it's essential to adjust the ventilator settings to low tidal volumes and higher PEEP to prevent further lung injury. This lung protective strategy helps reduce ventilator-induced damage. Question 32. A patient with sepsis has an elevated white blood cell (WBC) count and C-reactive protein (CRP). What does this indicate? A. The body's immune response to an infection. B. An autoimmune disorder. C. The presence of a viral infection. D. The presence of multiple organ dysfunction syndrome. Answer: A. The body's immune response to an infection. Rationale: elevated WBC and CRP levels are indicative of inflammation and immune activation in response to an infection. These markers are commonly elevated in sepsis and help to confirm the presence of infection. Question 33. A patient in septic shock has a serum lactate level of 8.0 mol per liter. Which of the following interventions would be most beneficial to reduce lactate levels? A. Start broad-spectrum antibiotics immediately. B. Administer intravenous fluids and vasopressors. C. Provide nutritional support to improve metabolism. D. Increase oxygen delivery via non-rebreather mask. Answer: B. Administer intravenous fluids and vasopressors. Rationale: high lactate levels indicate tissue hypoxia and inadequate perfusion, which can be improved with fluid resuscitation and vasopressor therapy. Antibiotics and nutritional support are essential, but are secondary to improving circulation. Question 34. A 45-year-old diabetic patient is admitted with sepsis and is showing signs of acute respiratory failure. What is the most important factor to consider when managing this patient's care? A. The patient's ability to tolerate higher oxygen levels. B. The presence of diabetic ketoacidosis, DKA. C. The severity of the infection and its impact on respiratory function. D. The patient's blood glucose levels. Answer: C. The severity of the infection and its impact on respiratory function. Rationale: in patients with sepsis, respiratory failure is often related to the severity of the infection and the resulting systemic inflammatory response. Managing infection and ensuring adequate respiratory support are the highest priorities. Question 35. A patient in septic shock is not responding to fluid resuscitation and vasopressor therapy. What is the next best step in managing this patient? A. Perform an echocardiogram to evaluate cardiac function. B. Start antibiotics at higher doses. C. Consider adding a second vasopressor agent. D. Administer corticosteroids to improve blood pressure. Answer. C. Consider adding a second vasopressor agent. Rationale. If the patient's blood pressure is not responding to initial vasopressor therapy, adding a second agent, such as vasopressin, can be helpful to improve vascular tone and blood pressure. Question 36. A patient with sepsis is being weaned off mechanical ventilation, but develops worsening respiratory distress. What is the next best step? A. Increase the tidal volume on the ventilator. B. Administer a sedative to manage anxiety. C. Perform a chest X-ray to assess for complications. D. Reassess ventilator settings and consider adjusting FiO2. Answer. D. Reassess ventilator settings and consider adjusting FiO2. Rationale. Worsening respiratory distress during weaning suggests that the ventilator settings may need to be adjusted. Reassessing the settings and optimizing oxygen delivery are essential to improving respiratory function. Question 37. A patient with sepsis and a history of heart failure develops tachypnea and hypoxia. What is the priority intervention? A. Increase oxygen delivery via non-rebreather mask. B. Administer a diuretic to reduce fluid overload. C. Start a beta blocker to slow heart rate. D. Increase the rate of intravenous fluids. Answer. A. Increase oxygen delivery via non-rebreather mask. Rationale. The immediate priority in this situation is to address hypoxia by increasing oxygen delivery. Diuretics may be necessary to manage fluid overload, but they are not the priority at this moment. Question 38. A patient with sepsis is being treated with antibiotics and fluid resuscitation. What is the most important parameter to monitor during the first 24 hours of treatment? A. Respiratory rate and oxygen saturation levels. B. Temperature and white blood cell count. C. Blood pressure and lactate levels. D. Blood glucose levels and renal function. Answer. C. Blood pressure and lactate levels. Rationale. Blood pressure and lactate levels are the most important parameters to monitor, as they reflect the effectiveness of fluid resuscitation and vasopressor therapy. Monitoring other parameters is important, but secondary to circulatory support. Question 39. A patient with sepsis has a blood pressure of 85/55 millimeters of mercury despite receiving 2 liters of intravenous fluids. What is the next appropriate action? A. Administer a vasopressor agent to improve blood pressure. B. Increase intravenous fluid resuscitation to 4 liters. C. Order a CT scan to identify the source of infection. D. Administer an antifungal agent to cover possible fungal sepsis. Answer. A. Administer a vasopressor agent to improve blood pressure. Rationale. In septic shock with persistent hypotension, the next appropriate step is to initiate vasopressor therapy to maintain adequate perfusion and blood pressure. Increasing fluids further could worsen fluid overload. Question 40. A patient with sepsis secondary to a skin infection develops increasing confusion. What is the next priority nursing action? A. Reassess blood glucose levels. B. Administer sedatives as prescribed. C. Check oxygen saturation levels. D. Obtain a full neurological exam. Answer. C. Check oxygen saturation levels. Rationale. Confusion in a septic patient may be due to hypoxia, especially if oxygen saturation levels are low. It is crucial to address oxygenation before pursuing other causes like blood glucose levels or administering sedatives. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.